Good afternoon, Mr. Speaker and members. It is my pleasure to introduce Senate Bill 793 by Senator Hill. SB 793 is supported by a broad coalition of over 160 public health advocates, parents, K-12 school communities, local government, and most importantly, young people. It's also supported by First 5 California, Planned Parenthood, the California Medical Association, Kaiser, and my personal favorite, the California Dental Association, all proponents of Prop 56, which increased the taxes on tobacco a few years back. According to the World Health Organization, more than 8 million people a year worldwide are killed by tobacco products. It's the most deadly consumer product ever created.
Members, please give your attention to Dr. Wood.
Thank you, Mr. Speaker. I'll say again, according to the World Health Organization, tobacco kills more than 8 million people a year worldwide. It is the most deadly consumer product ever created. Tobacco use is the leading cause of preventable disease, disability, and death in the United States. More than 16 million Americans are living with a disease caused by smoking. Smoking causes cancer, heart disease, lung diseases, diabetes, and chronic obstructive pulmonary disease, which includes emphysema and chronic bronchitis. The state spends over $3 billion a year on the treatment of smoking-related illnesses in the Medi-Cal system alone, while overall healthcare expenditures on this is over $13 billion in the state of California. The number in smokers in California is lower than it has been in many years. That means Big Tobacco is working harder than ever to attract the next generation of users to their deadly products. In 2018, 67% of high school students who used tobacco products in the last 30 days reported using a flavored product. One of the most popular flavors is menthol. The CDC says, quote, tobacco companies add menthol to make cigarettes seem less harsh and more appealing to new smokers and young people, end quote. I spent my entire professional career trying to protect people from the ravages of tobacco addiction. I've seen firsthand gum disease, tooth loss, and oral cancer associated with smoking and smokeless tobacco products. I'll never forget some patients who, even while undergoing chemotherapy and radiation from cancer associated with tobacco, continued to smoke. They just couldn't quit. You know, I've never met someone who said the best decision I ever made was to start smoking. I love waking up in the morning and coughing as I reach for that first smoke. Really enjoy the fact that it takes me longer to get over a cold. I love how fresh my house and my car smell and my clothes smell after I've been smoking. Instead, more than 90% of smokers wish they'd never started. 9 out of 10 smokers start before the age of 18, and 99% by the age of 26. And flavored tobacco products are a huge contributor to this. This bill will ban the sale of flavored tobacco products in retail stores in California. This includes vaping products and those little cigars, the second most popular product among high schoolers, with flavors like mango, tropical fusion, and chocolate, and about 25 more. These little cigars sell for as low as $1.49 for 2, and are the second most popular product among high school students. And Big Tobacco is working hard to maintain the ability to sell these. While the opposition has spent millions of dollars fighting this legislation, pointing to the exemptions made along the way, the core of this bill, designed to protect kids, remains intact. In a perfect world, there would be no exemptions in this bill, but we all know we don't live in a perfect world. Whether it's vaping, smokeless tobacco, cigarettes, or small cigars, we know that flavors attract kids, the next generations of smokers that Big Tobacco needs to continue to peddle their deadly products. The choice is simple. It's pretty simple to me anyway. Vote yes to help protect kids, or vote no to protect Big Tobacco. The choice is yours. I'd say one more thing that's related to the potential loss of tax revenue, which I've heard the opposition speak of, should this bill pass again. I would note that all of the coalition supporters for Prop 56, the most recent tobacco tax legislation, are in support of this bill. And I'd also like to note that I've been working with the Assembly member from Merced, who is looking at a vaping tax, It may not happen this year, but I'm committed to work with him I agree with the structure and the enforcement mechanisms that go along with that. If we can't do it this year, I look forward to making that a reality in 2021.
30 seconds, Dr. Wood.
When you consider the tremendous potential for huge downstream savings on healthcare costs to treat tobacco-related diseases, I would actually consider the revenue loss as an investment in prevention for the future of the health of Californians, something we actually need to do more of in this state. I respectfully ask for your aye vote.
Thank you, Dr. Wood. Mr. Bloom, you are recognized.
Thank you, Mr. Speaker. Members, I've been working on tobacco-related issues for my entire career in public service. It's now over 20 years. Tobacco is an addictive poison, and the industry model depends on hooking people at an early age. The range of long-term health issues arising from tobacco use and secondhand smoke is well known to all of you and well researched. Currently, we are learning more and more about the comorbidities of COVID-19, and compromised respiratory systems is one of the most significant. Getting young people hooked on candy-flavored tobacco puts them in jeopardy now and possibly for the rest of their lives. The tobacco companies know that almost all new tobacco users begin their addiction as kids, but they also know that to novice smokers, tobacco can be harsh and unappealing, and internal tobacco industry documents show that tobacco companies have a long history of using flavors to reduce the harshness of their products to make them more appealing to new users, almost all of whom are under the age of 18. By masking the harshness and soothing the irritation caused by tobacco smoke, flavors make it easier for beginners, primarily kids, to try the product and ultimately become addicted. The cost of care for tobacco-related illnesses to our healthcare system and insurance programs is astronomical. Similarly, the misery caused by these same illnesses, along with shortened life expectancies, is an abomination. According to the World Health Organization and National Cancer Institute, smoking and its side effects cost the world's economies more than $1 trillion and kill about 6 million people every year. The economic costs of tobacco use are substantial and include significant health care costs for treating tobacco-related diseases and the lost productivity that results from tobacco-attributable morbidity and mortality. A study from the University of California, San Francisco found that over the last 30 years, the California Tobacco Control Program, our program, has reduced actual medical costs by an astonishing $500 billion. This amount only includes medical care costs, doctors, hospitals, drugs, and related costs, and not indirect costs such as lost productivity or the value of lives lost, or the value of those people who have to deal with disease. The savings in those areas are generally even more than the direct medical costs. Like previous efforts to reduce tobacco consumption, restricting the sale of flavored tobacco products would be a public health and economic victory for California. SB 793 would save at least 17,000 lives and $800 million in health care costs in California, and I respectfully ask for your aye vote.
Thank you, Mr. Bloom. Mr. McCarty, you're recognized.
Thank you, Mr. Speaker. I think our colleague from the North Coast and from Santa Monica outlined it. Just a few outstanding issues. The first is, this is not the perfect bill we wanted, but it addresses 95% of what we want. And these misleading ads from Big Tobacco make it seem like we're ignoring the interest of where kids are smoking. The 3 exemptions that we unfortunately had to put up, kids really aren't going to hookah lounges where you have to be above age to use it. They're not focusing on Premier cigars and pipe products. It's the vaping, flavored vaping. We know that menthol is a gateway in so many of our urban communities. So this is really the focus as far as how we want to prevent youth smoking. I want to talk about the thing that really, I think, drives me the most nuts when I see these crazy ads, is this is going to hurt funding for kids in our schools. This is the outright lie. First, number one, schools are 100% funded by Prop 98. Zero impact on dollars from tobacco taxes. The tobacco taxes that do come forward fund things like First 5, programs for 0 through 5, some health programs. These First 5 commissions are in support of this measure. They would like nothing more than to go out of business. They've been declining in revenue on a yearly basis. They know that. Their expenditures are not ongoing. They know that this is a declining revenue source. They're in full support of this. If you look at the number one thing that you can do as far as tobacco education, the opponents, Big Tobacco, thinks keep this in place to protect kids, to focus on anti-tobacco education. Well, the thing that's the most anti-tobacco is banning the products in the first place and stopping kids from getting hooked in the first place. This is what this is all about. We're not going to be tricked by these outrageous ads that we see up and down California. Our public health experts know this is the right thing to do. This is the time for this, and this is time for California to really step up and protect our youth. Thank you.
Thank you, Mr. McCarty. Dr. Arambula, you are recognized.
Thank you, Mr. Speaker and members. Today, I rise in strong support of SB 793, not only as a doctor that has witnessed firsthand the harmful effects of smoking, but also as the chair of the Budget Subcommittee on Health and Human Services. Members of my committee know that we spend hours upon hours listening to passionate and heartfelt pleas for resources from hundreds of worthy groups and thousands of worthy causes. I love my committee and the issues we cover, but it is hard because we never have enough money to fund all the needs of Californians. To my surprise, I have heard the opposition to this bill who use what I think is a bizarre and a desperate claim as a reason to oppose this bill. They say you shouldn't vote for this bill because it will not allow public health groups like First 5 and others from being able to do the valuable and substantive work in their committees. They go on to say that this will put pressure on the general fund and our healthcare system. First, let's be clear. By the fact that if this bill passes, less people will become addicted to tobacco and less people for generations to come will smoke, our healthcare system will greatly benefit from the reduction in the enormous costs of dealing with the health efforts on individuals who smoke, and our state will actually save a significant amount of money. But let's put that aside and delve deeper into the first claim. I am sure a lot of you got a letter from CMA, from CDA, from Planned Parenthood and Kaiser, the people who spent millions of dollars putting Prop 56 on the ballot and securing its passage. These are also the groups that come to my committee along with others and very passionately make requests on how to spend Prop 56 money on essential health care costs. They make it very clear that if the result of this bill is less children becoming addicted to smoking and that results in less revenue for their priorities, then the purpose of Prop 56 is working, and then supporting this bill is a no-brainer. First 5, the American Lung Association, the Cancer Association, the Heart Association, I could go on, but there are 140 different groups and organizations in support of this bill, all of which come before my committee and ask for money. Yet all of them are saying without question and without hesitation that the best thing to do for public health and even public health care funding is to protect these kids, break the nasty cycle of letting children being targeted by Big Tobacco, and to vote in favor of this bill. If there truly is less money, then their mission is working. The mission of these groups is not to get money from the state. It is to prevent more people from smoking and better functioning health and having a better functioning healthcare system. But do you know who doesn't come to my committee asking for money? The tobacco companies who are opposing this bill. They don't care about public health, so don't let them fool you with their advertising campaign. The opposition doesn't care about public health at all. They are trying to say whatever they can so that they can continue to target our kids. Don't fall for that, members. If you care about health care in this state, align yourselves with those who are fighting every day to improve our health care system, not the people who inflict billions of dollars of health care costs upon our constituents every day. I respectfully ask for an aye vote.
Thank you, Dr. Rambula. Mr. Bonta, you are recognized.
Thank you, Mr. Speaker and colleagues, for the opportunity to rise in support as a proud co-author of SB 793. And I want to take the opportunity to address one of the more troubling and frankly misleading and flat out untrue claims some opponents of SB 793 have been making, and that is this, that this bill criminalizes tobacco use and will lead to increased interactions between communities of color and law enforcement. Colleagues, this is simply not true. Let me assure you that if it were, I would not be a co-author of SB 793, and I suspect many of my colleagues who have joined on as proud co-authors would feel the same way. Simply put, SB 793 in no way, shape, or form criminalizes individual use or individual possession of tobacco products. What the bill does do is this: it restricts retail sales of these products and retail possession with the intent to sell. Not individual possession, not individual use. This bill, in fact, is specifically crafted not to criminalize youth or communities of color. I was proud to support the historic tobacco reforms we enacted in 2016 with many of you. Those reforms removed youth penalties for possession and made our tobacco control laws more equitable. SB 793 rightfully focuses enforcement on the tobacco industry, not their victims. Local governments across the state, including in my district, are successfully implementing ordinances that restrict flavored tobacco sales without any evidence to support these frivolous claims of criminalization. And in addition, I just want to touch on what our colleague from Fresno touched on, that while a ban on flavored products could reduce tobacco tax revenue in the short run, it would also result in significant savings in the long run, specifically $13 billion in reduced healthcare costs annually, according to a recent source. The ultimate goal of tobacco taxes is to get that tobacco tax revenue to zero. That means it's working. That is its design, that is its intent, because that means we have defeated tobacco addiction and protected the health and lives of Californians. So don't let our opponents, including big tobacco, try to scare you into thinking that this bill somehow hurts vulnerable communities. They have neglected to tell you this, that because of industry tactics, low-income neighborhoods, those with mental illness, the LGBTQ community, the Latinx community, the African American community are disproportionately burdened by tobacco-related morbidity and death. We can no longer subsidize the healthcare costs of big tobacco. We will not criminalize communities of color with this bill. Far from harming, SB 793 will protect our communities from the proven dangers of tobacco. I respectfully ask for your aye vote, colleagues.
Thank you, Mr. Bonta. Mr. Flora, you are recognized.
Thank you, Mr. Speaker. Members, I rise in strong opposition to this particular piece of legislation. And not because I'm actually want to stand up in support of tobacco, but actually because I just think this bill is completely hypocritical. If we actually cared about kids, if this wasn't just an ideological fight against big tobacco, if we actually truly believed in what we're saying about our youth, then there would be no exemptions. We would not be taking exemptions for hookah, for cigars over $12, for other things that have been taken to make this bill pass simply so we could get the votes. And even worse, there's another industry that's just getting a free pass. We have communities, my district, with dispensaries everywhere. Our kids are smoking cannabis, inhaling it all day long. But because it's the new cool kid on the block, we leave it alone, and we go after tobacco. Friends, we have to address this. If we care about our kids, we must address all of this. We must figure out a way to keep this out of our kids' hands. On my phone right here, I have a picture of a nerd, like those old little candies, the Nerds candy, a nerd rope There's 8 servings in this package, 400 milligrams of THC in that package, 50 milligrams per serving. Friends, I would be unconscious if I took that. You can't tell me that we are not marketing this stuff to our kids. So I would just ask us as a body, we are going to take a significant cut. There's going to be a $200 million cut to the general fund with the tobacco tax. And I understand what friend from Fresno is talking about as it relates to this. I get it. It is a big hit. In a pandemic, this may not be the time to do this. But more importantly, friends, let's be honest. I understand that this building does not like big tobacco and hasn't for a long time. But let's not hide behind the kids. Because if we actually cared about the kids, we deal with some of the other industries as well. Thank you.
Thank you, Mr. Flora. Ms. Rivas, you are recognized.
Thank you, Mr. Speaker. I rise as a proud co-author of SB 793. Like the members from Sacramento and Fresno and others have already brought up to us, there has been so much disinformation on this bill. But I think it's important for all of us to refocus our attention on what the bill actually does, and that is protect our kids. I trust the record of the hundreds of youth advocates and public health champions that are behind this bill. I strongly urge an aye vote. Thank you.
Thank you, Ms. Rivas. Ms. Peacher Norris, you are recognized.
Thank you, Mr. Speaker and members. I too rise as a proud co-author of SB 793. I rise as a mom who has seen my 12-year-old in 7th grade offered flavored vaping products in the bathroom by the cool kids. And I also rise as the niece of my Uncle Murph, who first became hooked on cigarettes when he was an 18-year-old soldier in Vietnam, and he became a pack-a-day smoker after a painful, heart-wrenching, and ultimately unsuccessful battle with lung cancer. He died too young, at the age of 53. He was like a father to me, and I was by his bedside in the hospital at the time. And I've got to tell you, seeing what he went through, my kids deserve better than that, and your kids deserve better than that, and all California kids deserve a better life than that. And this bill is an opportunity for us to make that a reality. And this isn't about not liking big tobacco or not liking anybody else. This is about loving California kids and doing what's right for California kids. So I respectfully urge an aye vote today. Thank you.
Thank you, Ms. Peacher Norris. In the rear of the chamber, Dr. Weber is seeking recognition. Dr. Weber.
Yes, Mr. Speaker and members, I too rise in support of SB 793. And I rise because obviously you've given all the reasons why we should be standing for this cause. Because we know the devastating effects of tobacco. And most of our loved ones who have passed away, and I've had a lot who have, always tell me that they began as a kid. They began when they were young. And as a result of that, they struggled with their whole life and actually gave their life as a result of it. So we can sit here and pretend that we're concerned about other issues affecting young people. And it's always amazing to me with all the legislation that I put forth, there's always another issue that we should be addressing without addressing the issue that is before us. So I want to encourage us to realize that, yes, this world is filled with issues. And if we're going to deal with them, we deal with them one at a time. And it's not easy to deal with any of these issues. But we have to begin to address the issue as it faces us. And this is growing. There's no question that tobacco was losing young people because why? We had a campaign on how ugly tobacco was, and how people who looked after they smoked, and how they looked without their lungs and without their throats and all those things. And so as a result, we now find the industry trying to attract them through other things. You can't tell me that the flavored tobacco is not something that is attractive to young people, not those who are already addicted, but it provides a way to addict others. And so I rise in support of 793. But I also rise as a person who has spent the last 50 years of her life learning and teaching African American history. And I am insulted that the tobacco industry would make an effort to believe that that mentholated cigarettes is a part of African American culture. And that's what's being stated. and that this is a discriminatory piece of legislation against black people. And so I've had people calling me saying, this is unfair to us. I said, someone wants to save us and our children and finally focus upon African Americans, and you consider that discriminatory. In that case, you would have been opposed to slavery, because that surely was discriminatory, since we were the only ones enslaved in this country. And yet you decided that that's something we should get rid of because it is undesirable and it has no benefits. When I look at the history of tobacco in the black community, it is not a cultural event. There's nothing about it that I have read in all the books that I've studied and all the research that we've done that says black people are more interested in mentholated cigarette, and somehow or another it represents their culture, it represents who they are, it builds up their value system, it gives them an identity. Are we insane? No, this is what we used to call watermelon politics. And if you're not familiar with that, then what happens in our community when I was a kid in the projects and what happened in the South, politicians and others would come through our community with a wagon full of watermelon and pass them out and talk and get votes and get support. Watermelon politics that you'd never see again. This is one of the most racist things to ever talk about, that black people somehow or another love mentholated cigarettes, and it's a part of our culture, and it's going to demonize us, it's going to hurt our grandmothers and our older people who are addicted to mentholated cigarettes. I am insulted as a scholar, as a member of this House, as a person who just required ethnic studies for every CSU graduate in the state, that someone who has not spent 1 minute talking about African American culture would have the audacity to tell me that this is black, that this is what black people are about. No, this is what racist folks are about who want to make $1 on black and poor kids, on young people who have color. This is what this is, and we should not confuse it. So if you think you're voting to help black people, don't do that. Vote for this bill, because this is not a race issue. This is an economic issue that has always pimped people of color and used them for the benefit. So I'm outraged as a member of this House, but most importantly, I'm outraged as a scholar, that they would use this to try to pretend that they are helping black people, promoting our culture, and then use our friends and our ministers and others to make us believe that there's some discrimination in this. I said, if they are discriminating against us this time, hallelujah, because it's a good discrimination. And maybe we'll get to the others later on who are at the hookah lounges and other places to make sure that they're protected also. So I want to encourage you to vote for SB 793 as a good bill that will begin to deal with the issue and protect our children from what we see is coming, which is a horrible habit that will devastate their lives and take the best of them. Thank you so very much.
Thank you, Dr. Weber. Ms. Gonzalez, you are recognized.
It's always difficult to make the choice whether to speak after Dr. Weber, or I'm sorry, my colleague from San Diego, but I've chosen to for a very personal reason. My mom started smoking when she was 16. A lot of you know I lost her very early. She ended up with breast cancer at 42, and then after remission, it came back as lung cancer. She died of lung cancer at 62. And the only thing she asked me is to make sure my kids never smoked. That seemed like such a simple idea as she was on her deathbed. Make sure my kids don't smoke. Smoking's gross. They heard it from everybody from the time that they were born. Should be easy. But like my colleague from Orange County said, when you end up having, especially young boys, but all kids in middle school and high school, you realize just how many kids are doing this, just how available these vaping products are. And guess what? It's not so gross. It doesn't smell so gross. It doesn't taste so gross. So as a parent, you spend your time trying to explain to your kid why something that society is saying this is much safer than smoking. This is not the same. You try to convince them that no, getting hooked to nicotine is the same. You're setting yourself up for a lifetime of disease. I wish everybody in this chamber had a middle school or high school aged children to just know exactly how prevalent this is. I didn't get the push in my district about this being somehow discriminatory against African Americans. I got a push about being discriminatory against poor people. And that too is offensive. Because I agree with my colleague from the Central Valley that the exceptions in this shouldn't exist. I think we should do our best to ensure that we're covering all tobacco. But what's discriminatory against poor people is getting them hooked on smoking and not providing health care, not providing the kind of information they need to ensure that they know what is happening to them, especially poor kids. So I'd be happy to continue to work on this. I agree that we need to do something about attracting young people to any kind of smoking or drugs. But you don't say no to something that's going to actually help today in order for a perfect solution in the future. You do what you can. We will save lives by passing that we know. I don't know all the statistics or the health reasons, and I'll leave that to the people who've worked on this. I just know as a parent, it'd be incredibly helpful to not have products out there that are attractive and not gross for our children. I think this gets us partially there. I'm proud to be a joint author on SB 793, and I hope that we get a lot of votes today.
Thank you, Ms. Gonzalez. Thank you, members. Mr. Speaker, you are recognized in the rear of the chamber.
Thank you, Mr. Speaker and members. Members, after reading the bill, it took me about 2 seconds to figure out what was the right thing to do morally. After I saw the advertisements from the opponents, I felt like that was 2 seconds too long. I'm proud to be a co-author of this legislation. Every person in this room knows the damage that tobacco use does to our bodies, our families, and our communities. And it is children who are the most vulnerable to its devastating effects. Their growing brains and lungs can suffer lifelong damage. Despite this, the average age of a new smoker is 13 years old. 90% of smokers start before the age of 18. In 2016, we raised the smoking age to 21 to help to prevent young people from being addicted at such an early age. But our work is not yet over. Big Tobacco has found an even more insidious way to hook our kids. Flavors like cotton candy and gummy bears make this poison taste like candy. These flavors are marketed toward kids and people of color to ensure tobacco companies have a clientele on the hook for life. This bill prevents retailers from selling the vast majority of flavored tobacco products we know kids are using every day. Let's continue the important work we started in protecting Californians from a lifetime of addiction and damaged health. I ask for your aye vote on SB 793.
Thank you, Mr. Speaker. Dr. Wood, you may close.
Thank you, Mr. Speaker and members, and thank you all the members who spoke in support of this bill. I very much appreciate it. To me, the bill is very simple. A vote yes is to vote to help protect our children. A vote no is to help protect Big Tobacco. The choice is yours. I respectfully ask for your aye vote.
And with that, the clerk will open the roll. All members vote. Who desire to vote? All members vote. Who desire to vote? Ayes 50, noes 0. That measure passes.